Hello, everyone. My name is Demelza McGinnis. I am a retired RN. My son is autistic and has other developmental delays. Due to COVID-19, he has been without his normal day programs for over 3 years now, challenging changes for him. Oh, no. Oh, sorry. And for me, I am introducing Wonkyung Jung, PhD RN from Johns Hopkins School of Nursing. Dr. Wonkyung Jung is a Postdoctoral Fellow in the Resilience Center at the Johns Hopkins University School of Nursing, Baltimore, Maryland. Her research interests focus on healthy aging and social integration among people with disabilities. The presentation title is Social Integration and Resilience. Dr. Jung will introduce the project Designed with You from the Resilience Center at the School of Nursing, Johns Hopkins University. Designed with You aims to identify the needs of caregivers with disabilities and develop tailored interventions using human-centered design. Also, she will introduce a project, Purpose in Life and Healthy Aging, which is a sub-project of Designed with You. Please hold any questions or comments until the end of the presentation, since Dr. Jung is new to Second Life. Welcome, Dr. Jung. The floor is yours.
Hello everyone, can you hear me? Is it okay? Okay, and also can you see the screen that I'm sharing? All right, thank you so much for all you do. So thank you so much for the wonderful introduction. And this is my pleasure to have this opportunity to present my research and introducing the Resilience Center at Johns Hopkins University. So my name is Wonkyung, a postdoctoral fellow at Resilience Center in School of Nursing, Johns Hopkins University. So today I am going to talk about social integration and resilience. So I will start with the motivation that why I chose this topic for my research. So before moving to the United States, I used to be the neuro ICU nurse for 10 years in Korea. So during the time, I took care of many older adult patients and who got the brain injury. So because I was only working for the ICU, after they were being discharged from the hospital, I never met them again. But as you know that the brain injury, particularly the traumatic brain injury, is an unexpected event that life before and after brain injury would be different. So I always wondered that how they live their lives with brain injury. So that's why I chose this topic for my research. So the term social integration has been recognized as an essential part of life to maintain health and well-being. Several studies have suggested that a high level of social integration is positively associated with health outcomes and well-being. So although a great deal of research has identified social integration is positively associated with health aging, reduce the risk of mortality and better health outcomes, including physical function and mental health. The concept of social integration does not have the standardized definition across these studies. Additionally, social integration has not been systemically explored or defined as a concept in nursing, so it is essential for nurses and other healthcare providers to have a clear concept of social integration in order to provide holistic care. So this is an article that I published last year about the concept of social integration. So if you are interested in the full manuscript, you can get it from the General Nursing Forum. So the purpose of this analysis is to clarify the concept of social integration in human health research and to identify attributes, antecedents, and consequences of the concept of social integration to enhance the understanding of the concept and its implication for health outcomes. For the concept analysis of social integration in this paper, Walker and Avon's framework was performed in 8 steps, and a literature review was conducted using PubMed, Sinner, and Embase to identify relevant articles published from 2001 to 2021. And searches of Google Scholar and biographic searches were also conducted to include the relevant articles in this concept analysis. And the following inclusion criteria were used if the keyword included in search of these databases were integration, social integration, social relationships, social participation, community integration, and socialization. Second, peer-reviewed studied, and third, the literature were written in English, and the search process and outcomes of the systematic literature review are presented in the figure 2, which is the right side of the slide. So that finally I got 51 articles to be included for this concept analysis. So the term social integration was firstly used in the 1980s by the French sociologist Émile Durkheim. So according to Durkheim, social integration refers to people interacting and connecting with each other in a community, and also the term used in several ways in different research fields. So for example, in human health research field, social integration was defined as a process of coping and adaptation, as well as a goal of rehabilitation for individuals with a variety of disabling conditions. And concept analysis includes identifying attributes that clarify the meaning of the concept and its unique characteristics. From the review of the literature, social integration encompasses 4 defining attributes: productive activities, social relationships, community engagement, and leisure activities. So the productive activity refers to any type of paid or unpaid activity that produces such goods or services of value. Previous studies have broadly identified productive activities as one of the type of activity, such as employment, education, and volunteer work. Second, social relationship refers to the overall level of the individual's environment with others. They include personal or informal social relationships, such as having a spouses and friends. In addition, formal social relationships, such as those with co-workers. And recreation or leisure refers to purposeful activities for relaxation, pleasure, and emotional satisfaction. Finally, community engagement can be defined as the frequency of participation in activities of the household, community, and wider society, and satisfaction with such participation. So the Walker and Evans framework requires identifying model, borderline, and control cases of the concept. Each type of case has been developed in the manuscript, and this is the example of the model case I developed. So the model case contains all attributes of the concept. So I'm going to read the model case. So a recent gastric cancer survivor, Mr. PJ, is a 59-year-old man who works at a bank. He suffers from an eating disorder, and since he suffered gastrectomy, so every day his spouse prepares his meal and drives him to work. While working, he sometimes feels tired, but he remains engaged in full-time work. His colleagues have provided encouragement and support as well as accommodation at work, allowing him to do his work and encouraging him to achieve his work assignments. Every Sunday he volunteers at his church. He describes volunteering at the church as the most enriching activity in his life. Sometimes when his schedule and the weather allow, his family enjoys being in nature, like hikes or camping. And the supportive social relationships have allowed him to perform his work, while volunteering and leisure activities have made him appreciate his life post-gastrectomy. And the next step of concept analysis is identifying antecedents of social integration. Antecedents means that the thing or events that existed before, and a variety of antecedents are associated with social integration, including individual or social actor and environmental factors. And the consequences of being socially integrated include improved physical and mental health, and healthy aging, and life satisfaction and quality of life. And the final step of concept analysis is determining empirical reference of the defining attributes of social integration. So there are some comprehensive measures proposed for assessing social integration, such as the multidimensional scale of social integration in later life, and the community integration questionnaire, and the participation assessment with the recombined tools objective. And since social integration is a complex and multidimensional concept, so empirical reference vary widely. Thus, multiple different instruments can also be used to assess the defined attributes of social integration. So the proposed concept of social integration is viewed as the process of incorporation and inclusion in society through productive activities, social relationships, community engagement, and leisure activities. And the findings from this concept analysis indicated that social integration is affected by various individual social and environmental factors. Furthermore, social integration supports several aspects of health and well-being, including physical and mental components, as well as life satisfaction and quality of life. Next, contribution to nursing science. So nurses, I think, not only provide nursing care, but also we have important roles as educators and supporters to assist the patients in their reintegration into society. So nurses should assess individuals for factors that inhibit their social integration, such as limited resources for productive activities and community engagement, and living alone in social isolation with depression, as well as lacking any leisure activities. And based on these assessment of factors that nurses should intervene in these areas in collaboration with other healthcare providers and the patient and their families. Also, this concept of analysis of social integration includes some limitation. So this paper does not address the culture aspect, as this was not addressed in the published literature that I identified in the review. So future studies should be conducted to examine the cultural components of the social integration. So this is the end of the introducing the concept analysis of the social integration. And then I am going to talk about a little bit about my career developments. So as I told you that I was an ICU nurse, that I think I was more likely to focus on caring for physical symptoms. And after that, during my PhD program, that I was focusing on social integration after traumatic brain injury population, that how they return to their lives. And then I realized that I want to learn more about lives among people with disabilities, not only traumatic brain injury. And it is well known that resilience and social integration are positively linked to each other, and both concepts affect improving health outcomes and quality of life, which can affect independent living. So I was looking for the postdoctoral position that I can do research for helping people with disabilities that they can live independent life. Also, I want to be the nurse researcher who can see the person with a holistic nursing perspective. So holistic nursing is based on the principle that patients or people biological and social and psychological and spiritual aspects are interconnected, and these aspects fit together to form a unique person. Thus, holistic nursing focuses on individualized care by understanding each patient's diverse needs. And then I also found the resilience framework that proposed by Dr. Zanton and Gill. I thought that this framework matched well with my research goal. As a nurse, that it is essential to view an individual within their environmental context for helping them recovery and resistance and rebound. So this framework posits that society, community, family, and individual factors can promote resilience. Actually, the center, the Resilience Center where I'm working now uses this framework. So according to the article, that resilience is defined as the resistance, recovery, and rebound of mental and physical health after challenge. And the Society to Cells Resilience theory is based on 6 fundamental tenets. According to the framework, each person is born with a resilient potential, and the potential changes over time depending on interactions between society, community, and family, and individual psychological and physiological and cellular factors, and how each factor reacts to a challenge. And in this framework, that individuals and families, communities can develop increased capacity through a particular challenge or life situation, and that they can later generalize and apply in other situations. And people in certain phases of life are more likely to develop new habits or take in important information. For example, caring for family member with disabilities. So this framework proposes that it is the nature of nursing to view variables in individuals, families, and communities and societies integrative, and to design collaborative interventions that will promote sustainable and equitable resilience. So interventions should be based on this perspective, and nursing interventions are not limited to individual patient care, but also extend to policy changes that impact the individual through societal and community change. So I would like to introduce the Resilience Center at School of Nursing Johns Hopkins. So resilience stands for the research and education to support the science of independent living for inclusion and engagement. National Center of Excellence Rehabilitation Research and Training Center that is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. And the center's mission is to improve the health and function of people with disabilities and their caregivers by adapting and scaling to award-winning evidence-based program, which are Chicago Parents Program and Capable. So Chicago Parents Program is for children, and Capable program is for the older adults with disabilities. And to design the new approach is using key attributes of effective and sustainable programs to ensure program effectiveness or relevance and utility and scalability. And we use the human-centered design to develop the intervention. So human-centered design is an approach to problem solving and design that focuses on understanding the needs and perspectives and experiences of the people who will use the product or service. So it is a user-centered approach that seeks to create solutions that are effective, efficient, and enjoyable for the people who will use them. And so for our center that we use this method throughout the research projects, life cycle, and to build the sustainability into the outputs. Therefore, we use the design for people who have direct experience with a disability or health condition, and its broader impact on their life should play a decision-making role in the design or services, products, and approaches to improve their health and well-being. So human-centered design typically involves several stages, including research and analysis, ideation and prototyping, and testing and iteration. So during the research stage, designers seek to understand the needs and motivation and behaviors of the people who will use the product or service. So this might involve conducting interviews, observations, and surveys to gather data and insights. And during the ideation and prototyping stage, designers use this information to generate and refine ideas for the solution, and they may create prototypes or mock-ups of the products or services to test and iterate upon. Finally, during the testing and iteration stage, designers gather feedback from users and make the adjustments to the products and service based on this feedback. So this cycle of testing and iteration continues until the final solution meets the needs of the users and effectively serves the problem at hand. So we do have several projects going on in the Resilience Center for intervention development and dissemination. So now as a postdoc in the Resilience Center, I am involved in capable family study and design the with you projects. So I am going to share the current stage of the two projects that I am involved. Before sharing the projects that I involved, I would like to briefly talk about the original Capable program. So capable stands for Community Aging in Place Advancing Better Living for Elders. So capable study is a person-directed home-based program that addresses both function and healthcare expenses. So the 4 to 5 month program integrates services from an occupational therapist and registered nurse and a handy worker who work together with the older adults to set goals and direct action plans that change behaviors to improve health, independence, and safety. And participations learn new skills, exercise, and how to work with additional tools, equipment, and home modification to improve function and safety. So capable focuses on prevention and problem solving, as well as building skills that participants can use in the future. So more than decades of the research showed that capable is effective for health outcomes at lower cost. First, the capable program improves the independence, safety, and health. Capable has been shown to decrease the hospitalization and nursing home stays by improving medication management, problem-solving ability, and strength, balance, mobility, nutrition, and home safety. Second, lowers healthcare cost. Research has shown that Capable has provided more than 6 times the return on investment. So roughly $3,000 in program cost per participant yield more than $30,000 in savings in medical cost, driven by reductions in both inpatient and outpatient expenditure. Third, capable program enhances motivation and self-efficacy. Through the client-driven brainstorming process, clients are given the opportunity to work as a team with their clinicians. So this process improves the client's self-efficacy and builds self-confidence to address challenges once the capable program is completed. Fourth, capable program reduces health disparities. So in the population of low-income older adults on Medicaid or Medicare who participated in capable, 75% of participants improved their self-care over the course of 5 months. And finally, capable program reduced the symptoms of depression. Symptoms of depression as well as the ability to grocery shop or manage medication also improved. Next, I am going to talk about the capable family. So the increasing prevalence of dementia includes a growing number of older adults with physical disability. 1 in 10 United States adults aged 65 and older has Alzheimer's disease, with some living as long as 20 years with co-occurring disability and dependence. This warrants the needs for caregivers to help with physical tasks such as bathing and dressing, which are costly in time and resources. Thus, there is an urgent need to maintain and improve the cognitive and functional ability of older adults with dementia. And while there are evidence-based programs that separately address cognitive impairments and physical ability, there are few programs that address physical disability among those with co-occurring cognitive impairments. And as I mentioned, the original capable study is an evidence-based program that reduced the physical disability but was designed for the people who are cognitively intact. So we seek to adapt the capable study to meet the needs of the older adults with a physical disability and mild cognitive impairments that and the early stage of dementia. So we also seek to meet the needs of the family members who serve as informal caregivers in relation to the physical function of those with cognitive impairments. So the purpose of the pilot study, the capable family, is to adapt the capable for older adults with mild cognitive impairments and early stage dementia and their family members. So for now, capable family study is completed enrolling participants. So we will continue foster interventions and will analyze the data. So there is the table in terms of the differences between the original capable program and capable family program. So first, the participants for capable are aged 50 and over who are dwelling in community. On the other hand, the capable family for aged 60 and over. And participants for capable are cognitively intact but have some difficulties with any activities of daily living, while capable family participants have mild cognitive impairments or are diagnosed with early stage dementia. Also, capable family includes care partners who provide 10 plus hours of care a week. And another project that I am involved in is called Designed with You. In the United States, 1 in 4 adults has some form of disability, and there are about 16 million caregivers who provide care to adults with Alzheimer's disease or dementia. So dementia caregivers are 1.5 times more likely to report caregiving related substantial physical difficulty, although caregiving does offer some health benefits. So in terms of caregiving research, current research focuses on the physical, psychological, and the physical social outcomes that result from caregiving. However, little is known about the disability status before the role as caregivers. Moreover, researchers have identified that caregivers have an excess burden and stress from family caregiving is associated with a higher rate of poor mental and physical health outcomes than non-family caregivers. So as you can assume from the name of the project, that Designed with You will use human-centered design. So we will involve participants in this project as a stakeholder, that their lived experience as a family caregivers with disabilities will be reflected on developing the intervention. So as I mentioned, the population for this project will be the caregivers living with the mobility or sensory disabilities who are caring for others with any type of disabilities and or dementia. And the study purpose is that we will use the human-centered design to identify the unmet needs of caregivers living with mobility disabilities who are caring for individuals with any type of disability, and use the findings to develop and then pilot test to a tailored self-regulation intervention that may improve their quality of life. So there are some specific aims for this project. So the first specific aim would be to explore the experiences, barriers, and unmet needs and social participation needs of approximately. And second, to develop the tailored self-regulation intervention and tailored that may improve quality of life, social participation, and activity efforts, and other identified outcomes for caregivers. And finally, to test the feasibility and acceptability of tailored self-regulation intervention and test the effect size of the intervention of quality of life, social participation, activity effort, and other identified outcomes for caregivers. So the inclusion criteria for this study are 18 years or of age and older, and community dwelling in the state of Maryland, and self-report of physical and sensory or intellectual disability, and self-report of serving as a family caregiver for the person with a disability. And the exclusion criteria include have a terminal diagnosis and or severe cognitive impairment based on the short portable mental status questionnaire. And then we define the family as an individual who is related by blood or affinity, or whose close relationship is equivalent to a family relationship. And family caregiver is defined as providing some type of support and assistance or nurturing to a family member for at least 5 hours per week. And we define disability as having a mental or physical impairments that limits one or more major life activities. And we include the different disability types in the initial phase of the proposed study to gain a wide understanding of the needs the family caregivers with disabilities may face. So the guiding theories for this study include the self-regulation theory and then disablement process. So first, the self-regulation will guide the development of the intervention for the study. Self-regulation theory consists of two tenets. So first, the participants manage their response based on their experience and knowledge of an event. And second, participants' goals are to maintain comfort and decrease the negative effect of the condition. And in terms of the disablement process model, there are extra individual domains and also intra-individual domain that are related to outcomes during this trajectory. So interventions surrounding extra and intra-individual factors can slow progress of the disablement trajectory or improve quality of life related to physical function and or disability. So we will demonstrate how a self-regulation intervention will be developed with the family caregivers and incorporate both extra individual and intra-individual domains to improve outcomes along the disablement trajectory among the family caregivers and with disabilities. So there are 4 phases for this method. So in phase 1, we will conduct one-on-one interviews and home observation with family caregivers with disabilities in order to understand the experiences of our adult caregivers with disabilities caring for people with disabilities, so that we will explore the needs, gaps in care and barriers and facilitators to receiving care for themselves and providing it for their family members. In phase 2, this phase falls under the synthesize and ideation phase of human-centered design. So we will synthesize findings from the phase 1 and integrate into the multi-stakeholder workshop. And in phase 3, we will create prototypes and conduct individual interviews with the family caregivers with disabilities and elicit their feedback on the prototype. And in phase 4, we will determine feasibility and acceptability and generate the preliminary effect size of tailored intervention, so that we will develop the intervention based on the feedback from the prototype. So now that this project is currently on the beginning stage, so that once we get the approval of the IRB, that we will start the phase 1. So this is the end of the presentation. So I am still learning as a scholar, so I will do my best to improve the quality of life in people with disabilities. So I sincerely appreciate your attention today. So I would be happy to take any questions, or if you have questions later, then please reach out to me with the email address on the slides. Thank you so much for your interest and attention. Thank you.
Could you please type the email address for us? Just type it
Let me
into
see the screen. Oh yeah, I will.
Oh, Electra typed it.
Okay, we have a few questions. Shiloh asks, in case I missed the clarification of caregiver, you are referring to familial caregivers and not nursing home caregivers, is that correct? And please expand on the definition of intra and extra individual factors. Thank you.
Sorry, where can I see the question?
It's in the local chat box.
Okay. Sorry, this is my first time, so I.
It's okay, don't worry. It's usually at the bottom of the screen, towards the left end of the screen.
Yes, and then it disappeared. So can you please type again about the question? Okay,
Dr. Jung, if you would simply click the chat button again, the window will reappear.
Oh, yeah. Okay, thank you. Yeah, so thank you so much for the question. So yeah, I'm referred that the caregivers for family caregivers, which is informal caregiver at home. And then please, and then the extra and intra individual factors. So thank you so much for the great question. So for the extra individual domains, for example, built physical and social environmental, and the intra individual domains, for example, lifestyle and behavior changes and activity accommodations.
Okay, next question is from Gentle. Says, Dr. Jung, these projects almost make me want to move back to Baltimore.
Thank you.
Did you always want to be a nurse? Ever aspire to be a doctor or some other kind of medical researcher?
Well, I didn't intend to be the researcher because I loved being a nurse so that I could take care of my patients. But during my tenure of nurses, that I felt that if I do study more, then maybe I can, improve my patients' life, not only at the hospital, but their lives. So that's why I decided to study more. So now that I would like to be the nurse researcher, but I didn't mean to be the nurse researcher. But my dream is as a researcher that I want to help and then dedicate myself to improve the quality of life of patients. Thank you.
Okay, next question is from Mook. And they say, I agree completely that social integration is necessary to health. However, to ask nurses to assess individual for inhibited social integration is complex. It may even be impractical. It will require retraining and re-education. Also, since SI is undeniably useful to health in any case, how will nurses decide the need or lack of need for SI intervention? And how will the level of appropriate SI will be determined, since SI is highly individualistic, changeable, conditional, and as was pointed out, has no standardized definition? Thank you.
Okay, so I would appreciate if you can type again the question, please. Mm-hmm. Well, I think nurses are the close person with patients, so that we have the opportunity to communicate and have a conversation with the patients and their families, so that we can recognize easily the how level of the social integration that they are, so that and also there are, you know, so several health providers at the hospital. So even not only nurses, but other health providers through the assessments and the conversation, then we can, I don't want to say the word decide, but we can recognize the needs of the social integration. And then several literature, you know, already revealed that social integration has the positive outcomes for the health regarding the physical and mental, so that we already know that social integration is the important factor of the health outcomes. But well, how level of the operative social integration is depending on the individuals. So it's, we as a nurse or health providers, we can offer or provide the intervention for the social integration, but I think it is also important to individuals or the patients themselves, though, so that they can decide that how much that they want to participate in the social integration. So that's the, or the collaborative nurses and healthcare providers and family members and patients themselves. It's all collaborative team that determine the level of the social integration. Did I answer your question?
Thank you. Mook says, yes, I admire your depth of wanting to care. Thank you. Polaris asks, have you looked at brain plasticity to reinforce the resilience in a person?
I haven't looked at the brain plastic as my research, but I know that there are some researches that the brain atrophy or the brain capacity is also the important fact, is associated with the social integration or the enrichment environments. So there are some research released now, but I didn't have any research from me.
Thank you. Jolly Carter asks, do you include services of art therapists?
Can you please repeat the question? Sorry.
Do you include services of art therapists?
Oh, art therapies. Yeah, so also from the literature review that the art services such as the music therapy or the drawing paint therapy also helpful for for the health outcomes or the cognitive function, and also that those art therapy can be the social participation, or also in that service that we can build up the social relationship, so it can be part of the social integration. So I agree that it is very important event that I recommend for increasing the social integration. Thank you.
Thank you. I think we're almost there. I have another question from Shiloh. Could you describe a couple of the barriers to social integration for the patient? Is it primarily related to patient mobility is an issue, or is it cognitive as well? Also, what if a family caregiver insists on social integration, but the patient resists?
Yeah, I also appreciate that if you type again the question. Yeah, definitely there are some barriers to social integration. So for example, we experienced the COVID-19 that now that the interventions or the activities at home. So we usually stay at home, that we do not go outside. So that's the one of the barriers. And also so the maybe internet access or the information that is also the important factors for the social integration. So engaging with the community is important to know what they have, the event or the intervention or meetings on the community. So that's another the social support that we may need to provide more information about the events that they can participate in those events. So the lack of the information will be the barriers. And also, yeah, maybe patient mobility will be the one of the issue for the social integration and cognitive function. But there are many different forms of the social integration. So social integration should not only outside of the home, but also it can be activities in their home. So even though they have some the disability, mobility disabilities or the cognitive disabilities, but if you have someone, like for example the family caregivers that assisting you, that maybe you can participate in some events or the meetings at home with your family caregivers. So it can be the barriers, but it is not the barriers as well. And what if the family caregivers well, so family caregivers and the patients, that again, the communication is the very important factors for the social integration. So the good social relationship, so social relationship includes the relationship between the patients and the caregiver, family caregivers. So during enough conversation or communication will be the good components of the social integration. Do you have any more questions or comments?
We have a comment from Shiloh. Says, in my perception, sometimes home-based caregiving has limitations to social integration, where nursing home environment may and often does provide opportunity for socializing. Family caregivers can work alongside nursing home caregivers to assist. I did art therapy with my mother while she was at a nursing home. My mother's cognitive abilities increased as I did art therapy and pet therapy with her.
Yeah, thank you so much for the comments.
Thank you very much for your presentation, Dr. Jung.
Thank you.
I'd like to encourage you to disconnect your slide controller, the big green square at the top. Oh, you did perfect. You're a great presenter. Thank you. I'm hoping you'll come back and tell us more about the programs as they get further developed.
Yeah, thank you so much for opportunity. That was very meaningful time for me as well. So I hope that I can have another opportunity to have a conversation with you all. Thank you so much.
Thank you. That would be great.